outbreak in Jamaica following Hurricane Melissa. Is a health crisis looming? Well, we have Jamaica's Minister of Health and Wellness, Dr. Christopher Tufton, to answer this and more. Minister Tufton, thank you so much for joining us on the Trailblazers TV. I do appreciate it, and I appreciate your responsiveness. We, of course, the news regarding leptospirosis outbreak is quite serious. I know you had a press conference already today and gave the nation an update, but from your lips to our viewers, how serious is it?
Well, it's always important to take these health risks seriously because it at the extreme it could cost a life. On the other hand, we could prevent it altogether. And in the context of the storm and the flood damages and the cleanup that's taking place, the risks has been elevated. And we've seen, of course, a spike in cases, which is why we had the press conference. So it's serious. It's not something that we should kind of, preoccupy ourselves with at the expense of everything else, because life has to go on. But what we have an obligation to do as health is to advise the country, give them information, help them to be guided on how to handle it, both from a prevention, but also a treatment standpoint, because it can be treated so that we minimize any loss of life and certainly any downtime from illness. So it is almost a necessity after a storm such as Melissa.
And you did mention the parishes that have been affected to date, which are St. Elizabeth, St. Catherine, Hanover, Westmoreland, Trelawney, St. Anne, St. James, and St. Mary. Now,
Right.
a few of those parishes were not considered among the worst affected. So, for example, a parish like St. Catherine, one would wonder if it's related to Hurricane Melissa. What's going on there with St. Catherine? Why it's affecting those residents?
Well, two things I'll say. The risk should not be confused with the wind damage from the hurricane. The risk is elevated because of the rain and the flooding. And all of Jamaica got heavy rain, and a lot of Jamaica got flooding. I represent a constituency in St. Catherine, West Central, and there are houses there that lost their roof, and persons who had major leaks and a lot of water runoff and so on. So the bacteria is spread through rodents, rats, or other animals, dogs, cats, livestock, and the flooding can spread the virus because rats will move from a dry place, they're normally in holes and in corners and crevices, to go to a drier place, which normally are in homes. And then the wetness also preserves the life of the bacteria. It can survive for for a much longer time when the place is wet. And so the weather pattern will influence where they go and how it is spread. And then, walking in the water, interacting with the flood, with the water, trying to clean up, all of that would contribute to the problem. So yes, it would affect all of Jamaica, even though some areas were hit worse than others.
And the 6 deaths, what
Right.
are those located in?
I think they're in St. James, St. Elizabeth, Hanover, Trelawney. I don't have the information in front of me here, but
Okay.
yes, the more worst hit parishes seem to have had the death. I think there may be one in St. Catherine too.
Wow. Dr. Tufton, I'm seeing some of the comments online, and there are some viewers who have expressed that when the opposition spokesman on health, Dr. Dawes, had raised certain concerns prior to Melissa, he was not taken seriously. What would you have to say as it pertains to that?
Well, I'm not sure on what basis anybody could have concluded that. Nobody really said anything to discourage any sort of advisory that was put out. Every flooding incident that we have in history, and the last being the previous storm, there is a spike in leptospirosis. It's almost predictable. So it doesn't take a genius to say we have that risk. I could have said it, and I did say it actually, that we would have mosquito-borne, vector-borne, and also other forms of risk associated with the storm. So what we're seeing is a realization of that, and we all should take it seriously. And that's no point did anybody discount what others said, whether it's the opposition or anybody else. The question for me and for all of us now, and the challenge is how we manage it. And part of this press briefing is part of the management. So I don't get bogged down in what people say. I think the importance is what we do about it, and that's what we're trying to do by through the advisories and the collaboration that is taking place.
Okay, and in terms of, you mentioned, of course, other waterborne illnesses. So outside of, for example, leptospirosis, is the government, is the Ministry of Health seeing any signal of any other suspected diseases looming?
Fortunately, we're not seeing anything on the vector front, meaning dengue, but we do anticipate an increase in vector-borne dengue in particular, because the mosquito population in the light of the flooding and the water storage, whether it's on leaves or in old cans and tires or otherwise, will lead to an increase in population. So what we've been doing is pushing the vector control measures out there. The team are out in the field, fogging, larvicidal activity, trying to kill the mosquito breeding sites. We do have the risks of foodborne and waterborne illnesses because food can spoil where there is no electricity for refrigeration. So public health inspectors are in the field. We have condemned a lot of meat and food kind that cannot be consumed, and they continue to do that in the interest of the public. And then, of course, there's a few cases of tetanus, people stepping on nails and sharp objects in the cleanup process, and then getting, that particular type of illness. So the risk is many. I was at Black River Hospital, the field hospital, like a week ago or less, and I saw a man being taken in who said he was from Kingston, brought to St. Elizabeth to fix a roof, and fell off the roof and felt that he broke his shoulder. So he was actually in the hospital. I don't know if it was broken, hopefully not, but was doing the examination. We've seen a lot of falls because everybody is trying to be their own carpenter or electrician. We have seen some electrocution leading up to the storm. We had one person was electrocuted and died in Hanover, I think it was. These are the risks that are associated with these natural events, and health has a big role to play in highlighting the risks and trying to manage the accident and emergency response, which is why in the immediate aftermath after the hurricane, the first business for us was to restore emergency services because we anticipated that we would have had these kinds of risks. So it's many and continuous.
Do you think the government was proactive enough, or are you being more reactive as it relates to the health concerns pre and now post Melissa?
Well, people will express their opinions, but I think we were quite proactive. We watched the storm. For many of us, we hope it never comes, and because we have had so many misses, there was a sense that some people felt a little complacent that it would have missed us. In health, though, we tried to be as proactive as possible, and just think about it. Within a week or less than a week after the storm, we had a field hospital set up in Black River. And that's not something you plan long after an event, you plan before the event. So we had started looking at those options literally in 4 days, I think, the Samaritan's Purse, which we had to negotiate with, give permission, accommodate, work with the JDF to get set up, identify the location. Now they're seeing over 100 patients a day. And luckily, they are there because the Black River Hospital was destroyed and had to be the patients had to be relocated. We rescued several persons via helicopter in the immediate aftermath because JDF was prepared, including a doctor out of Black River who had an injury, babies that were damaged, and we had to fly them out because there was no road passage through to other hospitals. We were able to mount a number of temporary facilities within 2 weeks because of health centers that were damaged. So guess what? We can always argue that things can be better because we learn from the experiences. But I think under the circumstances, health has done well. And remember now that the health workers were victims too. They lost homes. They had to contend with all of that while at the same time providing a service. And I really do believe that we've done well, and we just have to continue to continue at it until we can get back up to normality and build some resilience in our system to avoid some of the shortcomings in the future.
How close is the synergy, Dr. Tufton, between yourself and, for example, Ministry of Community Development and the local government ministry? What is that synergy taking place there, especially as it relates, for example, to cleaning up? Because as we know, rats, rodents, they thrive in such environments. And I specifically asked that question because, for example, even in my area, it was just this week, literally 3 weeks since the storm that our garbage was collected. And I'm in Kingston. So can you imagine that this is not just going to only affect the parishes that were affected, but also in the east as well?
The Office of Disaster Preparedness has a multi-agency, multi-ministry approach to planning and responding to these emergencies. Health is very much involved in that. So we work closely with local government through the NSWMA and Solitary of Labor in terms of welfare support. We reach in the communities. So yes, we work very, very closely together.
Okay, but you would have heard from residents of reports of uncollected garbage and things like that, which of course can contribute to a health, I don't want to call it a crisis, but health challenges then.
Well, the truth is that the storm has created significant additional bulky waste. I mean, I give you an example of Catherine Hall in Montego Bay, where the NSWMA removed over 1,000 truckloads of waste because of the two rivers coming together and overrunning the entire community. There's an estimate that we have to remove now 500,000 truckloads of garbage, of solid waste, because of the flooding. So it's going to be unusually high because of what the flooding has brought on us. Some of it is debris by nature, trees, falling trees, zinc that has flown off, sidewalk, covering, and all of that. Others of it may be actual waste that was thrown in the wrong place, in the streams, in the gullies that found its way out. So it's expected. What we have to do is move quickly to clean up, because in doing so, we reduce the risk of the disease spread that I've just spoken about.
And already earlier you alluded when you mentioned about the field hospital in St. Elizabeth, already in terms of field hospitals and health facilities, especially in those affected areas, um, that the government has in place, and to deal with situations of increased cases of leptospirosis, or as you mentioned, tetanus, or any other illnesses that may arise.
Well, we've done well in that we've set up St. Elizabeth through Samaritan's Purse. We've set up a field hospital at Falmouth, on the compound of the Falmouth Hospital. That's the Spanish government. We're now in the process of setting up one in Westmoreland at the Sav Hospital in conjunction with the Barbados government and army. We're looking at setting up a 100-bed facility at Cornwall Regional, a dome-type facility to add more bed space while we repair those facilities. Those are all called Tier 1 facilities, that are facilities that come with a lot of equipment, with personnel, with operating theater, pharmacy, lab, that sort of stuff, except the dome in Montego Bay, which is just bed award space. Then you have that's the tier 2. Then you have the tier 1 facilities, which are the health centers, and we've set up a lot of those smaller tent type structures in communities like White House in Westmoreland, where those health centers have been demolished or damaged. And then you have the NGO community who have come, some with those facilities, and they have been certified once they are qualified doctors or nurses, and they have been placed in communities. And then we have the mobile clinics and mobile pharmacy, the NHF coordinating that, that goes into communities and are giving prescription drugs to persons who are chronically ill, who may need particular types of drugs and can't make their way to the regular pharmacy at this point. So, there's an army out there, then the vector workers, the public health inspectors, but we have phased it in because of the limitations and the priorities, starting with emergency services, hospitals, then working our way into the communities. And I have to say that we have done fairly well to this point. I don't know of anyone who has a life-threatening illness and cannot go to a hospital emergency room at ground zero, and indeed anyone who needs medication and can't get it, and that's a good thing. So I really celebrate the health services and the people who have been involved in it and the teamwork. We have POW helping us, we have IDB working with us, we have a number of agencies, and indeed the local organizations like the JMDA, the Medical Doctors Association, the surgeons. So it's been a real teamwork, and I celebrate that and give thanks for that.
Dr. Tufton, will this leptospirosis outbreak change, for example, the government's medium to long-term public health strategy?
No, well, there are always lessons to learn from every challenge that you confront. And there is a period of reflection that is involved, assessment of how you do things and how you improve. COVID was a great teaching experience. I was on the bridge leading that charge with the government, and I wrote a book about it, Wild Flavors, which is really the COVID experience and primarily trying to highlight the lessons from COVID as part of emergency management and leadership. And I hope other generations will see that as a learning experience for them. I raise it because I say that we always must approach things from a standpoint that we're not perfect, that we can build on what was done and learn more. And the same could be said here. But having said that, we do have an emergency response manual, protocol, approach. We do exercise it when it's needed, as we have done and are doing now. And if you heard in the press briefing today, the Pan American Health Organization rep Ian Stein spoke, and he heaped a lot of praises on the health system and the resilience and the way we have approached the Melissa response. And that's coming from an independent source. He's independent. He's part of the big or multilateral type of system. So that's validation to some extent. But again, you approach these things with a lot of humility because you're never too old to learn, put it that way.
Is there a timeline in terms of the government's, your ministry's projection in bringing the outbreak under control?
It will dissipate once we get rid of the water. So when the place dries out, when the bulky waste is removed, when the measures around rodent control are becoming more effective, when the dead carcasses are buried or burnt or gotten rid of. So, my view on it is that assuming all other things being equal, in economics we call it ceteris paribus, over the next few weeks, I could see where things will go back to normal. I do see mosquito population increasing, and therefore the risk of dengue will continue into the holiday season, meaning the Christmas season. But I'm hoping that with the resumption of electricity and the cleanup that is taking place over the next 2, 3, 4 weeks, we should see much improvement. That's my own view. I'm not a medical doctor, but based on my own experience, I think it will get better.
And in terms of mental health, I know you're big on that. I actually read a Gleaner article yesterday where residents in a particular community in St. Elizabeth, I don't remember the name of the community, but they were saying that they need mental health help because they really are suffering in terms of dealing with the aftermath of Hurricane Melissa. What is being done on the ground as it relates to that?
There's a lot that we're trying to do. We have brought in an expert out of PAHO around providing mental health or psychosocial support. We're building out a kind of group at the parish level, starting with the mental health teams at each parish, but expanding that to include some volunteers, to include some other disciplines that can be brought up to speed quickly around just basic psychosocial support, giving a listening ear, providing basic support, counseling, advice, elevating the more challenging ones to higher levels of capacity. The truth is that no Jamaican in recent years would have experienced what Melissa has done to the communities that have been impacted. And the young people would have been traumatized, but the older people would be too. And I've seen it. I've been out there. I've seen people just sitting on a rock, dazing in space, not knowing what to do. It's really a traumatic thing. And unless you go and see it, you don't understand it. And in a sense, there are two Jamaicans right now, because when I come to Kingston, it's almost like nothing happened. You drive down past Pertree Hill, you're in a different world. And it's been transformational for the negative. So we need to give support, and that support is necessary, at all levels. So we intend to continue that. There are a number of specific initiatives. Part of that is, how do you reassure people that there's hope? How do you give them some basic support? Government will do some of that. They have been doing some of that. The NGO community, friends, family, and how to ensure that the systems resume, the education system, the healthcare system, that kind of thing. So there's a tall task ahead. It's going to be a few years before we see any close resemblance to what normalcy resembles, because of the rebuilding that's going to have to take place. And we're going to have to just have a long-term program to give that support. So mental health is a top priority for us, and we're going to do a lot and more in the future.
Indeed, and there's certainly two Jamaicans because I've been to some of the affected areas giving out relief, and a stark difference between there and, of course, Kingston.
Mhm,
So there are some, in fact, your opposition counterpart has said that a health crisis is looming.
mhm.
Not to be alarmist, but would you say that's the case?
Well, I don't know. Crisis is a very extreme word. It depends on how much weight you put on the meaning of that word, and I don't mean to be theoretical or abstract, but I have to face the context is important. So the context of the storm creates, as you have said, a lot of loss and despair and fatigue. And those persons need hope, and we have to find ways to give them hope. So the mental health part of it is important, and we're mobilizing for that. The health threats like leptospirosis are expected, but I think we can resolve them in a relatively short period of time if we get all hands on deck in terms of the cleanup and so on. The hospital services availability, I think we have been able to do fairly well in the short term to resume basic services. That's requiring some build out over time for the permanent structures to be put back. But I think we have a plan, and we will work to that plan to ensure that emergency services are maintained, and of course primary healthcare services. So we're gonna have to walk and swim at the same time, kind of, because we're gonna have to be building out the health centers while the services are maintained. It may mean a tent in the yard, it may mean an alternative building. That's what management and leadership does. So I will never say to people that we have a crisis in the sense of a crisis, meaning people don't have options and they don't have the services, because that's not the case. Is it going to be challenging? Of course, because we've had a very difficult time. But Jamaicans will have health services. We will be able to solve their problems once they have those problems, or at least elevate the problem to where it can be solved. And we're going to strive to continue to do that because we're a resilient people. And I don't want to scare people into thinking that all is hopeless and all is at loss. I'd never take that position. Otherwise, my job would be redundant. I'm here to solve problems, and I focus on solving them no matter how severe they are. And I think we can together get them solved.
Penultimate question. In hindsight, is there anything that you would have done differently prior to Hurricane Melissa?
Boy, that's a big question. I have not even thought about it because maybe I haven't had the time to think about it. Um, I mean, the system has held up from the standpoint of responding to what would have been an unpredictable, and you can't predict it, and you didn't know how severe it would have been, or if it would even come. Um, you know, 2020 vision is hindsight. So maybe if you knew that a roof was going to be lifted up, then you would have probably reinforced the roof. If you knew that the water tanks on the top of the building at Cornwall were going to be punctured by flying objects, then maybe you'd have tried to store water somewhere else. I, we've adjusted to the challenge, and I think we did the best that we could. But we will review the process and see what lessons can be learned in terms of building more resilience in the system.
Final message to Jamaicans at this time, Minister.
Well, just to say that all is not lost. There's life, there's hope, and we have been through worse. We have seen COVID that hit us hard, didn't destroy buildings and properties. So a different kind of challenge, but the interesting thing about COVID, I tell people, is that at at some point in time, every one of us felt vulnerable to the COVID virus. I mean, everyone on the planet, even those who never believed in vaccines or in the virus, they felt that it could have taken them out. That's a very unusual occurrence. In Jamaica, we did what we had to do. We never had all the resources that other countries had, but we did better than many of them. And so I think we can pull through any severe challenge. So I say to people, no matter how bad your situation is, just think it through and we'll find a way. And the government is here to help, to give support. And we will, in public health, always be there to give that kind of critical health support.
Thank you so much, Minister Tufton. Another time I'll invite you back so we can speak about the book, but we're in a different time at the moment, as you
Yeah,
understand.
right. Not a problem. All the best to you. Thank you.